Hi guys, COVID-19 is real. 2020 has been a very challenging year as we battle COVID-19 with its social rules. Some of us have had to deal with lockdowns, curfews, quarantine, isolation, and whatnot. Soon enough, we will all come to realize that this wave of a pandemic is gonna linger on for a while if we haven't already come to that realization yet. I know we have been saturated with tons and tons of news on COVID-19 and wouldn't want to be bored with more info. But if you are watching right now, it means that there is still some level of interest, and I would like to add my voice to precautionary measures presently being taken. There are so many times these questions pop up. What are we going to do? Are we going to stay home all year round? Are we going to constantly live in fear of acquiring the virus? These are all pressing questions that need to be answered. But strange and unfortunately, there are no hard, straight answers to give. On the far end of the spectrum, there are some who believe COVID-19 is a myth. Interesting beliefs they share, but I would like to dwindle this belief because COVID-19 is still real. A lot of people have died from it, and frontline workers are working tirelessly to save patients. If you have doubts, there are several stories on YouTube of survivors of this disease you can look at. Vaccines and medications for this disease are being vigorously pursued and are in different phases now. Being a novel disease, it behooves on us to take maximum precautions. These precautions existed way before the virus found its way into our lives and should still be continued after vaccines and treatments are properly instituted. Hopefully, it will happen soon and herd immunity will be achieved. In the meantime, we need to take serious precautions against this novel virus. A brief reminder about the spectrum of symptoms, and these include chills, cough, fatigue, headache, sore throat, nausea or vomiting, runny nose, diarrhea, muscle pain, shortness of breath, and there are more symptoms being discovered, and you should look out for these symptoms as they come. Finally, the Western world is opening up and Africa will follow suit. As we open up our borders, schools, churches, and other public places, it is imperative that we know how to conduct ourselves so we don't end up with the disease, having worked so hard the last couple of months protecting ourselves from it. Most of us have heard time and again how hand washing with soap and water for at least 40 seconds, hand sanitizing for at least 20 seconds, wearing a cloth face mask when going out into the public, and social distancing, keeping at least 6 feet or 2 meters apart is so important in reducing transmission. And I would still like to re-echo this point. Even though sometimes it is very difficult to achieve, I pray and hope that we are all taking these precautionary measures seriously and practicing them to the best of our ability. Try to go to the hospital only when necessary. Do not go visiting any patients at the hospital if you are not an essential caregiver. If you have to go to the hospital, try not to touch surfaces at the hospital. Do not try to explore the hospital, move around to see what other places they have in the hospital or to see friends. Go do what you are supposed to do and leave. As Africans, we really do love to shop at our local markets. I would advise those who can afford to buy things in bulk to do so, and that will reduce your market visits to the barest minimum, about once a month. If you can't afford it, these other precautionary measures can help. Do not take too long trying to get stuff at the market. Get what you need and leave. Don't try to converse with the customer or anybody else. Please do plan to get everything ahead of time. If not, it becomes difficult and you are at a higher risk if you do visit the market on a regular basis. As market women, we need to keep our shops and surroundings clean. Keep 6 feet apart from customers. Always wear face masks when talking to customers. You could go a step further and have a glass screen or a plastic screen placed between you and the customer, and that could really help to reduce the spread. Public transportation contributes greatly to the spread of coronavirus. And as Africans, we use the bus stops and public transport a lot. On the bus or train or any means of transportation, do not try and talk to the driver or make conversation. Do so only when necessary. Avoid touching high-touch surfaces such as handrails, and immediately use hand sanitizer after alighting from the bus. Please try and limit close contact with other passengers on the bus or train. Also improve airflow by opening the window or placing air conditioning in non-recirculating mode. We all do have a duty to perform in curbing this pandemic. This will go down in history well if we try our best to protect ourselves and others. At this point, I would like to say kudos to all health workers and frontliners for your big sacrifice. Thank you so much for watching my channel. Please do subscribe, leave comments below and suggestions down below, and we will be quick to reply. See you next time.